Hi, I'm Dr. Doug Richie. Today we're going to talk about in-office adjustment of custom functional foot orthoses. In our practices, we use custom foot orthoses regularly to treat patient conditions and allow them to return to an active lifestyle. And most of the time, these devices really work. But once in a while, like it or not, we'll have a situation arise where some part of the orthotic is irritating the patient's foot and we need to make an adjustment so that they are more comfortable on the device. We have the option of shipping the device back to the lab, but that means taking away the device from the patient and waiting 1 to 2 weeks for turnaround, and also sometimes there's a shipping charge. Wouldn't it be a lot better if you could make the adjustment on the spot in the office so that your patient can leave right away with the device? You're going to restore their confidence, they're going to be a lot happier, and they're going to get well a lot quicker. To do these adjustments of orthotics in the office, you need just a few simple tools. And the first is a heat gun. And the heat gun is well worth investing in because it can be used for applications other than just adjusting foot orthoses. It can be used to put top covers on to help the glue dry and other applications. It's always good when you're heating devices to have protective mittens or gloves so that you don't burn yourself. And as I will show you, sometimes you're going to need to have a pair of pliers or some other device to grip the orthosis. The first adjustment I'm going to show you is the medial arch. And that's probably the most common situation where a practitioner has a need to adjust a device because it's literally digging into the arch of the patient's foot. One thing I want to point out is that most custom foot orthoses are relatively matching pair right to left. I've set these two devices on the ground for this patient, and you'll notice that the arch height is relatively similar. It's interesting when you do this, if the patient is getting skin irritation, it's usually on only one foot. And when you look at the devices this way, where you match up the arches, invariably you'll see a little high spot, perhaps on one device like we see here, and that happens to correspond exactly to where we need to make that adjustment. Often in the treatment room, it's helpful to put that device up against the patient's foot and mark the device with a piece of tape indicating where that arch is irritating the patient's foot. Sometimes the patient will tell you, sometimes you'll see a red mark on their foot, but it's good to mark it with a little piece of tape on the device so when you go into the back of the office and you're going to do your adjustment, you know just exactly where to target. It's important to bring both right and left back because we need a reference right to left to allow us to compare the adjustment as it progresses. So I'm going to demonstrate a technique where we're going to spot heat and lower the arch of this right orthosis right at the mid portion of the arch, which corresponds to where it's bothering the patient. So we're going to be heating up this device with a heat gun. It's going to get pretty hot, and so we either are going to put on protective gloves, or one of my favorite techniques is to use a buffer made of either cork or Corex, as I'm going to cut here. And we're going to lay this on the top of the orthosis after we've heated it, and it allows us to push down evenly across the whole arch. Number one, it insulates so we don't have to wear gloves. And number two, it gives more even pressure across the arch so that the arch lowers in a more uniform way instead of, as I say, dimpling with just a fingerprint. So a strip of Corex laid on top of the orthosis allows us to push down and reduce the height of the device without having to put gloves on. It acts as an insulator, but it also gives a more even distribution of pressure. I'm going to demonstrate a technique to lower the arch of a graphite or composite orthosis. Now, the reason I chose this material to demonstrate is because this is the easiest material to adjust. Once you heat it, it becomes as pliable as butter very quickly, and it's very easy to precisely lower the arch. At the same time, it's very easy to over-lower the arch. So the word of caution here is do this in gradual steps or do it incrementally, and it's much better to go back and lower it a little bit more each time, because once you've over-lowered the arch, you can't really put it back. That's why I have the comparison orthosis standing by, because as I lower, I keep bringing them back together to see where the new arch height is compared to the other foot. So I kind of take a mental picture here. This arch is a little higher than that arch. I'm going to go ahead and attempt to lower it to match this arch, but I want to make sure I don't over-lower it, so this will be my point of reference. So we're going to turn the heat gun on to high. Some people ask, can you do this with a hair dryer? You actually can get the composite material hot enough with a hair dryer. It just takes a long time, 3 to 5 minutes. Whereas with a heat gun, it's about 30 seconds. Do not overheat. You can actually cause the composite to break, and you can cause it to collapse very quickly, and you lose the whole contour of the orthotic. So we have this on a hot setting, and we're going to just try to target that central part of the arch where we're going to make the adjustment. So I've had the heat on there for about 30 seconds. I'm going to lay this here, and now I'm going to gently push down, and you can see that it deforms very easily, and I try to use even pressure with my fingers, perhaps a little more right at the central arch. Now, it's best to bring it back over here as a comparison, and you can see just with that gentle pressure, I've already lowered that arch to match this arch. It was a little higher, now it matches, and if I'm not happy with that, I can push down a little more. Now the nice thing about the composite material is you don't have to hold it very long. You can hold it for 10, 20 seconds, and it pretty much stays where you left it. So I've lowered that arch about 2 millimeters. And believe me, that's pretty profound in terms of improving comfort for the patient. My advice would be to run this under cold water. It cools it off right away, so it holds that shape. Take the device into the treatment room, match it up to the foot, and go ahead and let the patient walk on it. Most of the time, they'll tell you it feels a lot better. If they're not happy, you're not happy with it, you can always come back and lower it a little more. But always start with a very small adjustment. Use the contralateral orthotic as a guide, and maybe push it down 1 millimeter to 2 millimeters just to start, and you can do it a little further if you need to. Run it under cold water, stop the heat process, and take it into the room. Now I'm going to show you the same process with polypropylene.